Hi, and welcome to another segment of Amazing Grace. My name is Jo Johnson. I'm your hostess for a very important couple that I have with me today. My guests are Dr. Curtis Bannister, way over there in the corner, and next to him is his lovely wife, Ms. Dr. Stephanie Corson. Welcome, both of you.
Thank you.
Good to be here. Thank you.
First question. Okay, Dr. Corson, maybe you can answer this. What are symptoms that a person feels after having an auto accident?
Oftentimes, people think of neck pain as the only symptom after an auto accident, but a lot of patients come in experiencing also low back pain, mid back pain, pain into the ribs, and the brain communicates with the arms and legs through spinal nerves. So at times people will have radicular pain into the arms and legs, such as numbness, tingling, or burning sensations. Another thing that patients will experience are headaches because of the muscle spasms in the neck and head.
Okay, Dr. Bannister, can you tell me how long it normally takes before a patient will feel pain?
After an accident, a patient can feel pain immediately. And certainly those patients, generally speaking, are the ones that have the most serious injuries and take the longest to fully rehabilitate. But very, very commonly, 2 hours after an accident to 2 days to 2 weeks. It can vary greatly. And there's a lot of factors that must be considered, but essentially what happens, you get a very slow swelling of the soft tissue structure, the ligaments, tendons, and the soft tissue structure becomes inflamed, and it swells, it swells, it swells, finally causes a lot of nerve root irritation.
Okay, so can you tell me, is it like a half an hour to an hour to 3 hours?
I think most commonly right around 2-3 hours.
Okay.
And unfortunately, that's when most people have left the scene of the accident, and maybe they've reported that they didn't have any pain, and so that kind of gets put in the record, and so that can cause a problem sometimes when they have symptoms later on.
Now, can you explain what a whiplash is? I mean, exactly what is a whiplash?
You want to describe this? I'll describe it. Basically, you have the head, which is relatively heavy. I'll use the spine to demonstrate it. Very, very heavy in comparison to the very slender neck. And then you have, of course, greater body mass here. So you have a whipping action, and it can happen. You can have an impact, obviously, from the back or from the side and traumatize the neck in various ways. What a lot of people don't understand is at the time of the impact, the head actually moves faster than the car. Right? That was,
wow.
It's a phenomenon. It has to do with physics, but an old friend of mine who was very good at baseball showed me how to throw a fastball, and he would get extra speed on the ball by whipping his wrist. The same sort of thing happens here because of the whipping action. There's a fulcrum effect, and this neck is very slender, undergoes a great deal of trauma at the time of impact generally.
Dr. Corson, can you tell us exactly what type of therapies that you perform with the patient with these type injuries?
Yes, when a patient who has neck pain, typically what I consider is that there might be some trauma to the disc. The disc is a cushion that lays in between the bones. The bones are very hard, and if there was nothing between them, it'd be bone on bone rubbing. So we're created with a cushion in between. During the time of the impact, sometimes the disc will come out of where it belongs and it will bulge or be herniated. So the patient feels pain. When the bulge or herniation is pressing upon a spinal nerve, you'll not only get pain, but numbness or tingling into the arm and fingers. So what we do to try to create some space between the bones and make room for the bulge disc, we put a traction unit on the patient's head, and it's usually very comfortable sensation to the patient because it's relieving the pressure. That helps to pull the bones apart and makes room, and the bulge disc over time will usually go back into where it belongs, and then the pain and the numbness and tingling goes away.
Now, following an auto accident and the patient goes into the hospital, Dr. Bannister, can you explain to us something about the cervical collars that they use?
Certainly. I think commonly, of course, they're often given pain medication, muscle relaxer. and often fitted with the cervical collar. I think the problem inherently with the cervical collar is that it immobilizes all the soft tissue, immobilizes the muscles. And what happens in a very short period of time, even after a few days, the muscles start to weaken and they become very dependent on it. And then the patient has even greater pain and problems. So I really discourage the use of those unless it's a grade 3 sprain strain, which is relatively rare. Most people have grade 1 or grade 2 cervical sprains at the time of the whiplash, and I don't think the cervical collars are generally necessary.
Who makes that determination as to what grade the sprain is?
The ER doctor would.
Okay.
But unfortunately, I think they kind of rubber stamp sometimes and give most patients the cervical collar, and I think sometimes it's contraindicated.
Can you explain about airbags? You know, are they good? Are they not good?
Airbags really are a good thing. Now, when they first came out years ago, they were very questionable, and in fact, they caused a lot of injuries, and they still do, but to a much lesser extent. I think that the new technology is out there where the airbags actually help a great deal. And unfortunately, the whiplash cases are still there, but maybe a little less often.
Dr. Corson, can you tell me what you recommend to some patients for some possible treatment that they can do in the home?
Sure. Whenever they have neck injuries, we typically consider that they've had loss of the spinal curve. Your body has curves in the spine to help absorb shock when we're walking. Straight spine would not be good because there would be too much pressure in the spine. So during an auto accident, there are contractions within the neck muscles that straighten that curve out, and you can actually see it on x-ray. So we give them a cervical pillow to take home with them that has a curve in it for their neck. And we have them start out gradually on it to stretch the neck and restore the cervical curve. And they work up to sleeping with it all night long. And usually people love these. They get kind of addicted to sleeping with them because they're so nice. And actually even people who don't have neck injuries can use those.
Very good. You know, we've talked about auto accidents and what can happen to your neck and to your back. Is there anything that you'd like to add in the last few moments that we have?
Well, I think that it's important to emphasize that subsequently to getting treatment by the chiropractor, it's very important to mobilize the neck, to exercise it, and to get it strong again. If you're going to have a little scar tissue, which generally happens, at the very least, you want it to be a mobile scar. You want it to be an elastic scar. You want the neck to be functional. You'll have less degeneration in your later years.
Wow. Well, most I can say is I want to thank both of you for coming and really telling us all about auto accidents. I just never thought much about whiplashes and neck sprains, but it's good to know what you can do and what you can do at home that's really going to help. Again, I want to thank you for coming.
Thank you. Nice being here.
Thank you
It's
for
really
having
been a
us.
pleasure for having both of you.